Hi, I'm Tammy Potter, and welcome to the Pregnancy Process Podcast, a show designed to help you navigate the hugely transformative journey to motherhood, where you'll hear the unique experience of experts in this area and the incredible stories of women sharing their conception, pregnancy, and postnatal journeys, so that you can have a healthier, more informed pregnancy. In today's episode, I talk to accredited practicing dietitian and gestational diabetes specialist, Robyn Compton. With over 30 years experience working in women's health, Robyn's impressive career has seen her work as a dietitian in charge in the diabetes unit at Royal Women's Hospital in Melbourne. She's also worked as a consultant dietitian to Diabetes Victoria and recently appeared as a guest speaker at the Australasian Diabetes Congress. Robyn now works exclusively in private practice, providing nutrition education and support for women with diabetes in pregnancy and pre-pregnancy. In this vital episode, Robyn reveals the food strategies she wishes every expectant parent knew, from practical dietary swaps for blood sugar control to real-world strategies for managing gestational diabetes, including meal planning, exercise, and the crucial role of food organization. We delve into the role of carbohydrates, proteins, and good fats in managing blood sugar levels, discuss the difference between fasting and post-meal blood sugar levels, and explore why some women may need medication. So whether you've just received a diagnosis or want to be prepared, this episode delivers the practical tools and reassurance needed to navigate gestational diabetes with confidence. Robyn, thank you so much for your time today. It's fantastic to have you here with us.
Thanks so much for having me, Tammy.
I'm really excited about this conversation, and I know we're going to go into so much depth, and I feel like this podcast is almost going to become a fantastic resource for all women that are facing a gestational diabetes diagnosis, because it's one of those times where if you have this diagnosis, it's really overwhelming. There's so much change going on during pregnancy anyway, and there's so many things that you need to think about, even with your nutrition. But then adding this extra layer of complexity on top, I know can be quite overwhelming for women. So I thank you so much.
Yes, it'll be a great overview, as you said, for anyone who's diagnosed and they're looking for some initial information until they see their team and get more specific advice. They can certainly get some solid evidence-based information by listening to our podcast as a starting point.
So let's start at the beginning. Let's say I have just been diagnosed with diabetes. If I was coming to you and wanted to understand what actually is gestational diabetes and what are the risk factors associated with this diagnosis?
Yes, look, often I'm the first port of call with the diabetes team, and patients are walking in the door and really want to know what actually is going on. So gestational diabetes is a type of diabetes that occurs just in pregnancy. And I'm sure you're aware that our hormone insulin controls our blood sugars, and insulin's role is to lower the blood sugar. But the placenta, the hormones are trying to raise the blood sugar. They're trying to get fuel over to the baby. The placenta's job is to feed the baby. And at a certain point in the pregnancy, the insulin just can't keep up. And so blood sugars just start rising. And this is when gestational diabetes is diagnosed. And of course, if it's not treated, the higher blood sugar can cross the placenta and impact the baby. And actually about 14% of pregnancies globally are impacted by gestational diabetes. Now, what's really interesting is that historically it was considered to be a complication that occurred with rising blood sugar later in the second trimester. So usually the test to diagnose gestational diabetes, which is the glucose tolerance test, is offered between 24, 26, 28 weeks. However, we now understand that gestational diabetes is quite a heterogeneous condition, and different degrees of insulin secretion and resistance in early and late pregnancy can underlie the timing of when it presents. And data is now showing that 30 to 70% of cases of gestational diabetes are now being picked up in early pregnancy. And so women that have got risk factors, which we're about to discuss, would usually be offered an early glucose tolerance test. And what we do know is that when gestational diabetes is diagnosed much earlier, it can be a bit more complicated to manage and can be associated with more risks. So we've got this situation where there's this complex interplay of factors, hormonal and genetic, that contribute to the development of gestational diabetes and whether it occurs early or late. And a lot of the risk factors are more family history of diabetes, age, cultural background, a background of polycystic ovary syndrome, expecting twins or triplets. Now, one of the risk factors is elevated BMI, a BMI over 30, which is a modifiable risk. But having said that, because gestational diabetes is so heterogeneous, there is no look. And women with no risk factors at all can be diagnosed with gestational diabetes. So really, even though there's risk factors, anyone with a placenta can develop gestational diabetes.
That's interesting, isn't it? And just for the audience, can you clarify what heterogeneous means?
Yeah, heterogeneous means it's very mixed. It's not just single cause. There's a variety of different conditions and situations that contribute to the gestational diabetes and the degree of risk.
Yeah, it's interesting because over the years, I've trained a couple of people that have had a gestational diabetes diagnosis, and they've been very different in the type of people that they are.
Yeah.
And I mean, one was an extremely athletic, strong, lean woman who was a sprinter. So she's an athlete. And I think from her side, it was probably more that hereditary diagnosis.
Yes.
But one thread that I found that was woven through all of the women that I've worked with that have had a gestational diabetes diagnosis is the guilt that they might feel.
Yes.
So, and I know many people do feel guilty about it, like they've done something that's caused it.
Yes.
So if you had someone coming to you that was feeling that way, what would you say to them to help them understand that it's not actually a personal failure? Because it's not.
Absolutely. And that's one of the first points that I say to women. And you can feel the sense of relief on their face when you go through this, that gestational diabetes is absolutely not your fault. We know that it's got multiple causes and different degrees of risks, and there's no look. Women from all walks of life, no matter what their age, education, background, size, eating a healthy diet, exercising regularly, can develop gestational diabetes. It's absolutely not due to eating too many sweets or carbs that some women believe. We need to destigmatise gestational diabetes. Unfortunately, there is a lot of misunderstanding in the community about what diabetes is, and people make assumptions and make throwaway comments when you've been diagnosed. It can be really upsetting and unfair, and most importantly, incorrect. And as I say to women in a nutshell, look, this has not been caused by your diet. However, we're going to manage it with how you eat and exercise, because what we're trying to do is help your insulin do its job of controlling your blood sugars by offering food choices and exercise that will help. And that's where the lifestyle comes in the treatment. But a poor diet hasn't caused gestational diabetes. And I think it's important for women to let go of that guilt and know that it's not their fault, and then move forward with working out what needs to be done.
Now, obviously, exercise is something that I'm extremely passionate about during this time, and something that I know that we share a similar thought process when it comes to, especially talking about exercise during pregnancy. For me, I know that when it comes to exercise during pregnancy, I would prefer to see women following individualized programs, because every pregnancy is so individual and every woman experiencing it is individual, and every pregnancy with that woman is going to be individual. So for me, individualization is key when it comes to training during pregnancy. And I feel like you're quite aligned with that as well. So can we talk about why, when it comes to the management of gestational diabetes, individualization is so important rather than just following generic one size fits all.
Correct. Look, there's absolutely not the one size fits all approach when it comes to gestational diabetes. As we've just discussed, it's quite a mixed bag of risks and presentation and situations. So the advice needs to be very much tailored to the individual. So women who are diagnosed early in pregnancy, they may be more likely to need insulin, and they will often need a more structured plan to match their insulin with their carbohydrate intake. Women who are diagnosed later in pregnancy, again, the advice needs to be individualised. They may do well with more general lifestyle tips. Others still need a really structured plan. I think it's really important to move away from food rules. You can have this or you can't have that, or long lists of food to avoid, which is often given out by hospitals, really out of date, not even evidence-based, just creating food fear. What works for one woman won't work for another. And my big approach is to talk about the right type of carb and the right amount and how to pair that in a balanced meal, which we'll get onto, and then see how their levels look and individualize it from there. One thing I'd like to say is there's a lot of food fear already in pregnancy, as you well know, with listeria and food hygiene. And then when you add this extra level of fear about what to eat for your blood sugars, some women are too scared to eat anything. So it's really important to reduce food fear and really promote women's confidence in their ability to make choices. And there might be a bit of trial and error, but that's okay. That's part of the journey. And my role really is to support and reassure and offer suggestions along the way.
So, in terms of specific factors, are there any specific factors that should be considered when you are tailoring a plan for an individual?
Yes. So first of all, I'd like to just give myself a plug and say that when someone is diagnosed with gestational diabetes, I would really recommend that they see an accredited practicing dietitian so that they can get this really individualized advice. There's a lot of correct general information out there, but as we've just said, there's no one size fits all. What works for one woman might not work for another. So women need that more individualized plan. And when I'm looking at a healthy eating plan for a person, there's a lot of things we're thinking about. So their appetite, their activity level, their cultural food choices, their food preferences. They might be vegetarian or vegan, maybe food allergies or intolerances like gluten or dairy, underlying health conditions that already have a dietary component with their management, their health goals, their weight goals, pregnancy conditions that are going on, like severe hyperemesis combined with gestational diabetes. That is not much fun at all. And expecting more than one baby, we need a lot more food. And also, what stage of the pregnancy they're diagnosed will influence the information given. And of course, their individual glucose tolerance to different foods, and making sure the diet's adequate for pregnancy. So there's all these things to think about, and that all needs to be considered in terms of the final sort of suggestion with an eating plan. And then that plan is just a starting point. We then head off with that plan, and the woman will start testing their blood sugars, and we'll see what's going on with that plan. And then that will need to be tweaked and modified throughout the pregnancy to help keep their blood sugars in target. So it's a journey, and it's hard to do that on your own. And it's really helpful to have the support of a health professional with expertise in gestational diabetes helping you through the journey.
Yeah, I absolutely agree with that. 110% across the board. This one size fits all approach, just when you're looking at pregnancy and there's so many, it's so complex and there's so many things going on. And when you add this type of diagnosis on top of it, like I said before, it can be so overwhelming. So working with a specialist, the same with exercise selection. There's so much conflicting and contradictory information out there that working with a specialist just takes the pressure off a little bit, that you're getting the right advice that's tailored to you individually. And if something's not working one week, it can be changed.
Yes,
You know?
absolutely. Absolutely. And I think
Mm.
a lot of women feel a huge sense of relief when they've actually finally consulted with the dietitian and had all their questions answered and feel like they've got a plan and feel more confident about what they need to do. And I think that's what I see as my role, is to really help women feel confident with their choices and comfortable with their eating plan.
I think food preference, because you mentioned food preference before, and when it comes to adherence, and I think at the end of the day, adherence to the plan is really important when it comes to nutrition, especially when you're facing something like this. So, food preference and food choices is really important. You want to be making sure that the food that you're eating, you're actually enjoying, and it's the foods that you choose to eat. You've worked with someone, they know that this is your preference, this is the type of foods that you like to eat, this is how you like to eat, and they've gone away and tailored your meals to be as close to your ideal as possible. So then you don't feel this lack or this less, or like you're missing out on all these things that you really enjoy, because there's already so many things that you're not getting that you actually enjoy during
Yes,
pregnancy,
yes,
potentially anyway. So
yes,
I think working with someone that can create a tailored plan that actually incorporates your natural food preferences
yes.
is really important. There's nothing worse than eating something that you don't want to be eating. That's the worst. No one wants that.
No, that's exactly right, Tammy.
I hate that.
Absolutely. And I think that, particularly because we see a lot of women from different cultural backgrounds that develop gestational diabetes, it's really important that any eating advice embraces their cultural food preferences. I work with women from many different backgrounds and really need to understand the types of foods they choose, the carbohydrate content of those foods, and be able to give them much more advice that suits their eating behaviours that fit in with their family and their community, and not give a list of food that they don't even eat. So it's really important to embrace the individual's food preferences and work with that.
So you've mentioned carbohydrates, and I know this is a pretty hot topic
Yeah,
when it comes to gestational diabetes. And
yes,
listen, we know how important carbohydrates are when it comes to pregnancy.
yes,
You need
you
carbohydrates during
do.
pregnancy. The baby needs carbohydrates because it's major fuel source for it. If you want your baby to grow and do all the amazing things that you want it to do, then you need to be eating carbohydrates, right? But there is sadly a common misconception that carbohydrates are the enemy when it comes to managing gestational diabetes. So, can you please clarify the role of carbohydrates in a healthy diet during pregnancy, but specifically for those with gestational diabetes?
Yes, yes. We've become a very carb phobic society, haven't we? And you
Not me. I love carbs.
and
I'm pro
so
carbs.
many women will say to me, "Oh, I was told to cut carbs and jump on keto."
Hate
And
that.
and look, frankly, that's irresponsible advice in pregnancy, because mothers and their babies need carbs for energy. You
Hmm.
need
Hmm.
energy just for your body to function day to day. Baby's brain needs energy. Baby needs energy to grow. And so, cutting out carbs, you're removing our body's preferred source of energy. And a lot of carb containing foods have got lots of other nutrients that are important in pregnancy as well, the B vitamins, minerals, and the prebiotic fibers. That's a big one. A lot of carb containing foods contain these really healthy, wonderful fibers that feed all the good bugs in our gut and help develop a healthy microbiome, which mum also passes on to baby. And as you know, Tammy, you need fuel for activity, and particularly if you've got a very
Hmm.
active life, you need to fuel that. Absolutely, pregnancy is not the time to cut carbs. It's all about choosing the right type of carb and the right amount, which we've touched on, and we'll talk about the type of carb in a moment. So it's about discerning with carb choices, not wiping carbs.
Amazing. So how could you go about, and I am very pro carb in all aspects of not only my life but my clients' life,
Yes,
and
yes,
everybody need no carbohydrates in your diet just makes you sad
and grumpy and tired and miserable to be
exactly.
around.
Yeah, exactly. So definitely in the pro carb camp here. But when it comes to tolerance levels, because that would be quite individual, right?
Yes.
What one person can handle is going to be different to what another person can handle in terms of carbohydrates. How would you go about figuring that out, so to speak?
Yeah, so when we're talking about types of carbohydrates for a start, we focus on a term called glycemic index. Now, glycemic
Mm-hmm.
index we abbreviate to GI, and GI
Mm-hmm.
tells us a bit about the rate at which a carbohydrate is digested and absorbed, and therefore the impact it has on blood glucose. So, low GI carbs tend to be digested and absorbed more slowly, and that leads to a lower post meal rise in blood glucose. So, obviously, that's going to be the preferred source of carb. And what contributes to that slow rise depends on a variety of factors. It might be the fiber content, the protein and fat content in the food, the type of starch, the physical form of the food, the way it's cooked, the acidity levels. So there's a number of things that impact the GI. And one of the key things that I do when I first see patients is teach them how to swap from high GI, which are foods that spike your blood sugar, to low GI, the carbs that will give a slower and more gradual rise in blood sugar. And that's a more positive message, doing a swap rather than taking food away. So we look at the typical carbs in the diet and say, look, instead of that, choose that. So, for example, instead of an ultra processed breakfast cereal, say rice bubbles, you'd go for a cereal that's got more fiber, say oats or a low sugar granola. Instead of a white bread, a multigrain or seeded bread or a traditional sourdough bread. Instead of short jasmine rice, the long grain rice like basmati rice or black rice, wild rice, red rice, the long grain wholemeal rice are better choices. Instead of instant noodles, soba noodles or egg noodles or udon or Hokkien noodles, we can choose pastas that have got more protein and fibre, or pulse pastas made with legumes. Instead of, say, traditional potatoes, choosing the low GI potatoes like charisma, light spud. The yellow sweet potatoes are lower GI. Most fruit is low GI. There's some varieties that are a bit higher than others. Berries are particularly low. Melons tend to be higher. Certainly fruit juice is high GI, so we'd discourage that. Milk and yogurt, because of their protein content, are naturally low GI. But when we look at the plant milks, soy and almond milk are lower GI than oat and rice milk, for example. And then in terms of crackers, swapping the really ultra processed water crackers, rice crackers for grainy seeded crackers. So we go through that list and I point out specific food products that they would put in their trolley. So to try and make the session as practical as possible, when we look at the low GI foods, I recommend brands to buy, because otherwise people are spending hours in the yogurt aisle looking at all the yogurts and thinking, which one do I pick and why? And so we just try and simplify that and say, this is a good choice for these reasons. And patients love that information because it really makes it a whole lot easier to get organised.
Absolutely. So is there anything else that's really important that you feel that we haven't covered when it comes to carbohydrates?
Look, as I said, I think the key thing is that we look at what a person's already having and then we modify that to get optimal levels, and then we look at the amount that they're eating and modify that based on how their blood sugar levels are looking, but at the same time keeping in mind the diet needs to be adequate for pregnancy. So if a person has to virtually eat no carbs to get a good blood sugar, we wouldn't be wanting to proceed with that. That's when we'd be talking about medication that we'll discuss down the track, so that women can eat a balanced diet that's adequate for pregnancy and feel satisfied and not hungry, but still achieve optimal blood glucose levels. And these are all the things that we consider, and that varies so much between individuals.
Yeah, it really does, doesn't it? Our bodies are so unique, and what might spike my blood sugar levels is going to be different to what might spike somebody else's.
I could give 3 women the same meal and they'd all get completely different blood glucose readings. So there absolutely is no one size fits all. There are some typical culprits that spike blood sugar levels, but women need to determine their own individual response to carbohydrates. Once we've talked about what would be better choices and work out an individualized plan, I would then encourage them to do a little bit of trial and error. Go away, try some different carbs, try different amounts, see what works for you. And if they get a few highs, that's fine. We're not looking at perfect results. We're looking at trends in range. But by doing that little bit of trial and error, they've developed confidence about what works for them, and then they feel more self-assured about making choices in the future because they know that some carbs work better for them than others. And that's all part of the individual journey.
I love that point there, because it is so, you're basically talking about making progress rather than perfection. Progress, not perfection.
Absolutely.
And that's what you're working with here. And that's something that I think it's been a key thing for me for a number of years now. It's that progress over perfection, progress, not perfection. Because I think as women, we do have this perfectionistic tendencies. And I think that comes from people pleasing and all that kind of thing. Yeah. That's a whole other story for another time. But it's that progress and not expecting to be perfect straight away, and just knowing that you're moving in the right direction and figuring it out along the way. And each little step that you make forwards is important in the journey of balancing your blood sugar levels. But we've touched on so many things here, and I think we might just try and follow the threads that have come up here, because so many have come up. And you mentioned protein previously.
Yes.
So obviously, you know, when it comes to your macronutrients, you've got protein, carbs, and good fats, and they all interplay together. So the type of foods that you eat together will change how your blood sugar spikes at the same time. So can we talk a little bit about that as well? What is your overall macronutrient balance? How does that help women control their gestational diabetes?
Absolutely. Yeah, the other macronutrients.
Sorry, that was really long-winded.
I totally know what you're talking about. No, look, the other macronutrients have a really important role with blood glucose regulation as well. So any discussion about diet, we talk about all the nutrients. So when we're talking about protein, as the key protein foods like meat, fish, chicken, eggs, cheese, tofu, they contain minimal carbs. So they're not going to directly elevate your blood glucose. But we know that when you pair protein with carb at the same meal, because protein takes longer to digest than carb, the blood glucose will go up more slowly because the meal is digested and absorbed more slowly. So you'll get a lower post-meal rise when you have your carb with the protein. For example, toast and eggs would give a lower post-meal reading than toast and Vegemite. Not that there's anything wrong with Vegemite, but there's having that extra protein helps. And it's the same with, and also in pregnancy, you need extra protein. Women need 3 or 4 serves of protein a day. So it makes sense to have some protein with each main meal, and that will help the post-meal levels. Good fats you mentioned. So the good fats are olive oil, avocado, olives, nuts, seeds, peanut butter. Like protein, those foods contain minimal carb, and like protein, they also take longer to be digested. So when you pair your carbs with a good fat, that will also slow the digestion of the meal and lead to a lower post-meal rise. So adding some avocado smash with your eggs in the morning can further slow the digestion of the meal. And then finally, veggies. So veggies contain lots of vitamins and minerals, but they also contain a lot of fibre. So when you put lots of veggies on your plate, you're building up the fibre in your gut, and that also slows the digestion of the meal and lowers the post-meal rise. So we recommend adding vegetables, certainly at least at lunch and dinner. If your meal would look good with veggies in the morning, like eggs and avo, you might add some mushrooms or spinach, but therein lies that sort of balance of macronutrients. And of course, protein, good fats and veggies, they don't only just slow down the rise in blood sugar, they provide other really important nutrients for pregnancy, and they make you feel more satisfied. So when you add them to the meal, you feel satisfied for longer and you don't feel as hungry. So the best sort of advice in terms of piecing all of that together, I talk about the healthy plate. And the healthy plate is where we're looking at what proportions of these foods should go on your plate. And we recommend that about half the plate be veggies or salad, about a quarter of the plate be protein and good fats, and then the other quarter of the plate be your low GI carbs. And that may be a very specific amount if that's necessary for you, as recommended by your dietitian. But that combo on the plate is likely to lead to a more optimal rise in blood sugar. And what I like about the healthy plate is it's a really handy tool when you're planning meals, because you look at that plate and think, okay, Monday night my protein's going to be meat, my carb's going to be a low GI potato, and I'm going to have that with some veggies. Tuesday night my protein might be bolognese sauce, my carb might be some pulse pasta, and I'm going to have that with a side salad. So when you're planning the weekly menu, you can use that plate to inspire you about how to design your meals and then get your food organisation up and running. And one of the key things I say to my patients is that the key to healthy eating for gestational diabetes is food organisation. And after our sessions, I encourage women to go home and have a chat with their partner or family and say, look, okay, what does next week look like? Are we home late some nights? Are we home a bit earlier other nights and I've got more time to prepare a meal? Let's do a bit of a menu for next week. Let's think about what I might have for my lunches. Let's think about what I might have for brekkies, what snacks I might have. Put together a shopping list on everybody's phone. Whoever does the shopping gets those ingredients. And if the fridge and the pantry are well stocked and you've got a list there on the fridge of what you want to do, you're 95% there. You're maximizing your chances of success. Whereas if you come home late, the cupboards are bare, you're tired, you're hungry, that's when bad decisions are made about food, and that's when people will get the spiked blood sugars. So setting yourself up by being organized really helps. And if I say one thing, at the end of the journey, a lot of my patients say to me, what's been really helpful about this is I've really learnt good food organisation skills. I feel like we're really much more organised now with our shopping and food preparation. And I feel a lot more prepared for being a parent and having healthy meals on the table for my kids because I'm now in a really good routine with that. So there are silver linings, I will say that.
Everything that you're saying is just like tick, tick for me. I love that food organizational skills because I think it is absolutely critical to be planning your nutrition as a whole. I think if you've got any kind of body composition goals, and being a coach, I'm not a body transformation coach by any means, but I certainly do work with women in that preconception stage that might want to or need to lose a few kilos in order to fall pregnant, or they're in that postnatal stage and like it's not the main goal, but they certainly want to feel comfortable in their skin again. So working with them around their nutrition is definitely something that I do. And when it comes to planning, I can't even tell you how important that planning is. Like planning ahead is key, but I'm always surprised about how many people don't plan their nutrition, don't plan their meals ahead, don't have their weekly shop. Like I use online shopping
Yeah,
for mine. I go through and just go tick, tick,
and
tick, tick,
that's a
tick.
great
And
advantage.
most of my like hard goods arrive, and then I like to go and choose my meat and my fresh fruit
Yeah,
and veggies
yeah,
myself.
yeah.
But everything else just arrives at my doorstep. It literally takes me 10 minutes and it's
Yes,
there,
yes.
which is fantastic. And also, I'm always a little bit surprised, and I think we need to up our game from an education standpoint around nutrition because it's always surprising to me how many people are lacking in education when it comes to their nutrition.
Mm,
I recently had someone asking me if banana has protein.
yes,
I was and this was someone that was like, they were older than me and they were asking whether a banana has, like thinking banana has protein.
yes.
I'm like, I'm sure it might have a gram or two in there, but like,
Yeah.
carbohydrate source. I
Yes,
think what you're doing is educating and helping people plan, which I think is so important.
yes,
But you mentioned snacks,
yes.
because snacks are very important.
They are. Snacking actually has an important role with the gestational diabetes
Mhm,
management for a number of reasons. First of all, it stops people from being hungry, and no one wants to be hungry, so snacks are important there. They also
mhm,
stop people from overeating at the next meal because the hunger's gathered momentum and then they eat too much at the next meal and get a
mhm,
higher eating. They're an important source of extra nutrients and calories because this is not a weight reduction plan. And if people are being too restrictive, then they could be losing too much weight. So adding in the snacks makes sure that they're getting in enough calories for pregnancy. And it's a great way of spreading the carbs over the day so that you've got
mm,
small, regular amounts of carbs. And that gives your insulin lots of little jobs and it can cope with that a lot better than a couple of big jobs. So by spreading the carbs into more moderate meals and little snacks, you're spreading that carb load. And when I'm
mm,
talking to women about snacks, there's different types of snacks. So snacks with carb, we want that to be a fairly modest load of carb, like roughly 15 grams of carb, because that's not going to spike the blood sugar and we're not going to need to test after snacks. We're just testing after meals. So if we choose a modest carb load at the snack, we can assume the snack is not going to spike the blood sugar. So that might be
mm,
things like yogurt, milk, whole grain crackers and cheese, fruit, suitable muesli bars, and I give them a list of healthy snack ideas that contain a modest amount of carb. But there's also snacks that contain minimal or low carb that they might just grab at any time if they're really hungry. And so that's snacks that have got more of a protein, fat, vegetable component. So that might be a handful of nuts or a piece of cheese or some chopped up veggies with a low carb dip like guacamole or pesto or something. So I give a variety of snack ideas. And so when families are doing their shopping, they can throw in the trolley lots of snacks. And I encourage that if you are going out to work, that you pack snacks and take them with you. Or even if you're going out for the day for appointments or whatever, take snacks with you, because if you rely on what you can buy at the canteen, it's probably going to be a blueberry muffin. There needs to be other options. And if you don't snack because there's nothing suitable, then you get home and you're starving. So I always give a list of sort of convenient snacks that people can just throw in their bag and take with them for the day. And that way they can be making healthy snacks and not being hungry while they're out and about. So that's all part of this food organisation that we've been discussing.
amazing. And all of this is just such great nutrition advice anyway,
Yes,
like for anyone, regardless of whether they're facing a gestational diabetes diagnosis or not. I hardly ever leave the house without some kind of like something in my
yes,
bag.
yes. Snacks keep you going.
Absolutely. Now, you've mentioned blood sugar levels a number of times through here.
Yes,
Can we talk about the difference between fasting blood sugar levels and post meal levels,
yes.
and what the difference is between both and why that's so important?
Yes. So when a woman is first diagnosed with gestational diabetes, another health professional that she'll see in the diabetes team is the diabetes nurse educator, the credentialed diabetes educator,
Mhm.
or the midwife at the clinic, who will teach the woman how to test their blood sugars. They're given a little meter and they're asked to test 4 times a day. So they're testing the fasting level, which is first thing in the morning, and then they're testing after each of the 3 main meals. And the time period does depend a bit on the hospital and the clinic, but it's usually 1 to 2 hours after the meal. So when we're looking at those levels, they give us some feedback about what's going on. So the post meal levels will let us know, is there too much or too little carb in the diet? So if a woman is getting levels that are quite low in the healthy range and they're hungry, we would encourage them to add more carb to their meal. If they were getting levels that are over the limit, it might mean that they need to have a smaller serve of carb or try a different type of carb. We tweak the meal plan to optimize the levels. The post meal levels also reflect exercise. So if a person's been more active over the day, their levels after meals will generally be a bit lower. Now, the fasting levels are a bit different. They really reflect your underlying insulin resistance. So how well is your insulin coping while you're asleep, which is not something that you can fix with lifestyle. They are more impacted by genetics and hormones than lifestyle. And this is really frustrating because women will be trying so hard with their diet and exercise and often getting fantastic post-meal readings, but have this elevated fasting level. And they think, what's going on? I'm doing all the right things. Why is that so high? Why can't I control that? And it's important to explain, look, that one is not due to lifestyle. You're doing all the right things, and that's reflected with your post-meal readings. But that fasting one is often more genetic and impacted by how well your insulin is coping while you're asleep. So if it's just marginally elevated, there's a few strategies that can push it back into the target range that we suggest women try initially. The first one is evening exercise. If you do a walk or even just housework around the home in the evening after sort of 5 o'clock at night, the muscles use sugar for energy during the activity, but overnight while you're asleep, the muscles take up extra glucose from the bloodstream to replenish their glycogen stores ready for the next time you exercise, and that can help lower the morning reading. So if it's appropriate for a person to be doing exercise in pregnancy and it's convenient, we would suggest some evening activity. Of course, that can also be difficult if you've got toddlers and your partner's not around and it's a crazy time of night. Trying to fit in 30-minute walk can often seem absolutely difficult. So we look at ways that they might do that. The other thing is optimizing the overnight fast. The theory being that if you fast for too long, the liver will start to release glucose to give you energy, and that may raise the blood sugar. And the idea of suggesting a snack before bed is so that the fast is not too long. And so some women will try a snack before bed, and they might try a snack with carb or without carb and see if there's a snack that seems to work better. But a recent study also found that women who didn't have a snack before bed got better fasting levels. So it was a small study, but therein lies the heterogeneity of GDM that we were talking about. So I would also say, look, try no snack or try a snack and see what works better for you with your fasting readings. We also recommend that you don't eat a big meal late at night, because then you're going to bed with all this carb in your system and your insulin overnight won't cope. The other thing that affects the fasting reading is the quality of your sleep, which of course is out of your control, but it is worth being aware of that link, so that if you've had a really rotten night's sleep, that might sometimes explain a higher fasting reading. But many women may have tried all of these strategies and worked really hard at it, and their fasting levels don't budge and they continue to rise as the pregnancy progresses. And that's when we would start talking about medication to help those fasting levels. And we'll talk about that in a moment. But it is important to know the difference between the fasting and the post-meal readings and why that information is so important for us.
I love the idea of exercise stacking. And one of the guests that I had on the podcast some time ago, I think it was last season, she mentioned exercise snacking in the evenings, like you're talking about, and potentially doing your housework.
Yeah.
And each time that you have a meal, try and time some type of activity after your meal.
Yes.
It doesn't have to always be going for a walk or actually training, or it could be so much as hanging out the washing or emptying
Yes.
the dishwasher, vacuuming the house,
Yes.
or something that gets your body moving that's not actually just sitting sedentary, not doing anything. So you're actually like mopping up that like glucose in your bloodstream. So exercise snacking is a really great way of helping with that.
Looking at it. Yeah, for sure.
Even if you're not like you're a mum that's got toddlers, I can guarantee you they're not sitting around at the end of the night.
No.
They may not have time to walk around and go and actually do some exercise, but I'm pretty sure, like most of the mums I know, they're lucky to get half an hour of quiet time at the
Sitting
end of the night
down,
after they've done
absolutely.
everything. So that still counts,
It
ladies. That still
absolutely counts. And I think if you are racing around all evening at home, that's your exercise for sure.
Yeah. Now, medication,
Okay.
because I know that some women, even just from the small amount of women that I've trained during pregnancy, those that have had to medicate again, I know that they've felt like a bit of a failure with that
Yes.
as well.
Yes.
Not only do they have the guilt of the diagnosis on top of that, if they haven't been able to manage their blood sugar levels with lifestyle modifications, then there's like another layer of guilt about the fact that they've actually had to medicate as
Yes,
well.
yes.
So that, I know that we've gone to that side first, but let's talk about why some women might need the medication to control it, and those common types of medication, how they impact things, and why this might be seen as more of a positive step than a failure.
Absolutely. Look, you absolutely hit the nail on the head. So many women, understandably, would like to manage gestational diabetes naturally with lifestyle. And absolutely, I'm in the game of trying to help them to do that. However, some women can try really hard and do all the right things, and their levels still remain elevated, whether it's fasting levels or post meal levels. And that's when we would introduce, we may need to start some medication. And women often do feel like it's a fail, that it's a fail that they couldn't fix it on their own. And so they're upset about that. They may be worried about the safety of the medication in pregnancy. They may have a needle phobia. They may be worried about the impact it might have on their birthing plans. So there's a lot of things going through their head. So it's really important to have this discussion with the diabetes team, because again, it depends on the individual as to what medication and dose they might need and why. And so explaining the different medications, how they work, what dose, and how that dose is going to vary during the pregnancy is all part of the education and support provided by the diabetes team to help women to go onto medication and see the benefits of it. So I guess there's two main types of medication that we would recommend in Australia: insulin, and there's a tablet called metformin. Insulin, as you know, is the same as our insulin, the insulin that you can buy at the chemist, and it is a miracle drug. It doesn't cross the placenta. It just helps your own insulin do its job, which is to control the blood sugar. And so we can target the insulin to the level that's out of whack. So if it's the fasting level, women can take a long-acting insulin at bedtime that slowly works its magic overnight and brings the fasting level into range. Or if any of the meals are consistently elevated, women can take a short-acting insulin with that meal that just works for a couple of hours and covers the carb load at the meal, and we can match the insulin to the carb load. So the dose can be titrated as the pregnancy progresses based on the women's needs. Now, of course, it has to be injected because it's a protein. If you took it as a tablet, your body would digest it, so it has to be injected. And so there is that, I guess, barrier for some women. And there's a risk of hypos, blood sugar levels dropping too low. So we always need to discuss that risk and how that would be managed and how to avoid that. So definitely a lot of education around that, but it is a very effective and safe drug to use in pregnancy, and it's probably the main medication we would recommend. Metformin is a different medication. It has different mechanisms of action, if you like. It has more of a general effect of lowering the blood sugar rather than a really targeted effect, and we can only increase it to a maximum dose, and above that we can't take more. It's used more for more mildly elevated, say, fasting levels. It can be taken as a tablet, which is an advantage, but some women have gut side effects, so we do need to introduce it slowly. But most women can tolerate it if it's introduced slowly. So again, whether a patient needs insulin or tablets very much depends on their individual situation and also the hospital and the doctor's preferences, and that decision is made in a sort of team discussion and then is provided. But it's really important, if levels are high, that women don't, okay, look, I don't want to have insulin or tablets, so I'm just going to cut out all my carbs and get good readings. And of course, not only will that make you feel miserable, it can compromise the growth and nutrition for your baby. We'd rather that you continue to eat adequately for pregnancy, and if your levels are high on that healthy plan, then we add medication so that your levels stay in the right range. And many women, when they start on the medication, they say, look, it's not nearly as bad as I thought it was going to be, and I'm actually a lot less stressed now because particularly with the fasting levels, I'm not waking up every morning panicking what my level's going to be like, because I know that the insulin's going to help it now. And I feel comfortable knowing my baby's not getting extra sugar, but I'm still eating for pregnancy. So many women do feel a sense of relief once they start on it, but there's always that initial barrier and fear, which is completely understandable. And that's why we try and really support and reassure women as much as possible. And of course, when the baby is born, the placenta's gone. So the source of the hormones that caused all the grief has gone. So the medication stops, and then you're not having it after you've had your baby.
The fact that the insulin doesn't cross the placenta, I didn't know that before.
Yeah.
So it doesn't actually cross the placenta. That's incredible, because
Yes.
I feel like a lot of women would probably feel like if they were taking insulin, what's it going to do to the baby? How's it going to, because their whole mindset is around, how is this going to affect my unborn child, which is literally the most important thing in their world, and rightly so. So even just understanding that that medication, the insulin, doesn't cross your placenta would be such a relief to some women.
It is, and because insulin is a large molecule, so in its entirety, when it's in the bloodstream, it's too big to cross the placental barrier. But glucose can cross the barrier, which is why the insulin is helping to lower the blood glucose so that less glucose crosses the barrier. With the medication I mentioned before, metformin, it does cross the insulin, it does cross the placenta, but there has been many clinical trials which have confirmed the safety of using metformin in pregnancy. But I guess this is why insulin is probably the preference, because we know that it doesn't cross the placenta and it can be really targeted. But as I said, there are a lot of things to think about with making that decision. And so we work out in the end whatever medication is the best match for the patient.
It's like a crash course, isn't it? I feel like a lot of people that get diagnosed with type 1 or type 2 diabetes, maybe that journey is a little bit
Yes,
slower for them.
100%. Yeah.
Whereas when you're dealing with this in pregnancy, it's like, straight ahead, you've got to know all this stuff and like action it very, very quickly.
Yes.
And it's in this short period of time.
Yes.
And you did mention post-pregnancy and once the
Yes.
placenta's gone,
Yes.
that things change. So we've already talked about how this journey can actually be a positive thing, and you can implement many different ways of planning things and gain some organizational skills, loads of knowledge around nutrition. What other things do women need to know when it comes to post-pregnancy?
Yes.
Because you've gained all this incredible knowledge and changed all these positive changes to your
Yes,
nutrition.
yes, yes. And just picking up
I'm
on what you said before, Tammy, I absolutely agree. It's a crash course in diabetes in a short period of time. And that's one of the reasons why women feel quite overwhelmed, and justifiably so. There's so much information to give in a short period of time, often in busy clinics where resources are limited. And this is where a lot of women feel a bit desperate for extra information. And I think podcasts like this and other credible platforms that have evidence-based information can supplement the knowledge base, which is exploding. But in terms of what happens after, so as I said before, when the baby is born, the placenta is delivered. So gestational diabetes goes away in the majority of women pretty soon after birth. However, we do need to talk about the implications of having had gestational diabetes on longer term health, because the research tells us that women that have had gestational diabetes are 10 times more likely to develop type 2 diabetes than women that didn't have gestational diabetes, and that roughly 50% of women may develop type 2 diabetes over the next 10 to 20 years. Now, that's a pretty frightening statistic. But again, it all boils down to the different risk factors and individual risk. So some women have got strong risk factors for type 2, and we discuss that with them at the end of the journey and arm them with strategies to try and minimise their risk. Other women have minimal risk factors, and they're probably going to be in that 50% that don't get it. So not everyone is guaranteed to get type 2 diabetes, but it's recognising your individual situation and what you need to do or work on throughout your life journey to look after your health and reduce that risk. And when we're talking about looking after yourself after you've had a baby, I'm not saying jump on a strict diet the minute you give birth to bounce back into shape. That just doesn't happen in the real world and is completely unrealistic. We want women to be eating a nourishing meal plan after they give birth that helps them to heal, that gives them energy to look after their baby, to support breastfeeding if they choose to breastfeed. And we know that breastfeeding, for example, increases insulin sensitivity. So longer breastfeeding is actually a protective factor against type 2 diabetes. So if it's suitable and it's going well for a person with breastfeeding, we would certainly encourage them to continue that for as long as suits them and their baby, because it can be protective. So when I'm talking to women about what sort of lifestyle things might you do after you've given birth, it's really just trying to hang on to some of the healthy habits which we discussed that they've developed during the gestational diabetes journey, because it's usually at least 3 months. So that gives you time to develop some new habits. And don't throw them all out the window when you give birth. Try and hang on to the ones that you actually have enjoyed or have got into a really good routine with. So, for example, the low GI swaps. I'll often run into patients say, I still eat that bread that you recommended when I was pregnant. So keeping up with some of the low GI swaps, or using that healthy plate template we discussed. That's an easy tool to try and keep designing your meals like that. If you've developed some good food organisation, keep that going, because that's going to help your family's nutrition as well. And we all know getting out of the house and going for a walk with the pram or going to the park with the kids, that's great activity for your mental health as well, but certainly also good for managing blood glucose levels. So it's really more practical, healthy habits, try and keep them going.
That bounce back culture really needs to just be
go away.
Yes. Now, if you have time, I have two more questions.
Sure.
Because when it comes to pregnancy, we know that everything's changing. It changes so much, like week to week, day to day. Someone can be feeling great one day and then next minute their pelvis is sore, or they could be eating one thing one day and then next minute then it doesn't agree with them the next. So how do you handle that kind of dynamic nature of pregnancy when it comes to what you do and working with women with their nutrition?
Yes, it's really a good point you raise, because it's often a message that gets lost in translation and it can cause a bit of grief, because pregnancy is a dynamic process. The placenta is growing all pregnancy, thankfully, and the baby is growing all pregnancy. Therefore, this is going to have an impact on the hormone levels in the body and the blood glucose management. Women can often go away after our initial consults, get their eating plan sorted, get great blood sugar levels, feel like everything's going well, and then suddenly the same meal starts giving them higher readings. And they're thinking, what am I doing wrong here? And the answer is they're doing nothing wrong. This is the progression of the pregnancy. As the placenta grows, it produces more of the hormones we mentioned, which increase insulin resistance. So the exact same meal can start to give a higher reading. So we need to explain that this is the progression of the pregnancy, and one of my roles when I'm helping women throughout their pregnancy journey is to help them with making progressive changes to their eating plan as the pregnancy goes along. So it might be, as we said earlier, tweaking the type and the amount of carbohydrate. If bread's not working very well anymore, try a different carb at lunch, etc. It might be that they need to add a bit more protein to the meal to slow the digestion a bit further. It might be they need to add in a bit more exercise around the meal to help with using those blood sugars. And if it gets to the point that they've tried every trick in the book and levels are still increasing, that's when the discussion about medication can take place. But often in the early stages, we can certainly tweak the plan. And for some women, that's all they need for the entire pregnancy journey, is that sort of guidance. So we never just give women all this information and dump it on them at the first appointment and then say, see you later, good luck. It needs to be regular checking in for the rest of the pregnancy to guide them on this journey. And as you said, other things can happen too. Some women can start to develop nausea that didn't have it before, or constipation, or get pelvic pain and they can't exercise anymore, or there's all these social things happening, their baby shower, their work breakup, all these things that, oh, how do I negotiate that? Oh, I'm a bridesmaid at a wedding, how do I deal with that? So life gets in the way, as it should, and it's about helping women to modify the advice to follow the journey, and that's part of my role.
I feel like we've come full circle with that, because we've come back to exactly what we were talking about right at the beginning of this podcast, is the importance of not having a one size fits all
Yes,
approach, and the
yes,
importance of individualization, which is exactly what I talk about when it comes to coaching and training during pregnancy. Even just touching on you mentioning pelvic pain and not being able to exercise, I feel like if you were following a one size fits all program, that would probably be potentially what would happen. However, if you were following an individualized approach
yes,
with a specialist coach like myself,
yes.
everything would be able to be adopted, adapted, changed, modified to ensure that you can keep moving and training during
Without
pregnancy. So
without further inflaming that condition, and that's so important.
100%.
Yeah,
Actually, it can probably help it.
yeah, yeah,
So,
yeah.
so the right exercises can help it, of course. So I think that is a really beautiful place to finish off, because we really have come full circle and just come back to individualization is key, whether it's with your nutrition or whether it's with your exercise selection. When it comes to pregnancy, really individualization is key. And I have worked with a dietitian myself many, many years ago now. And let me tell you, I still use the basis of what we worked on in terms of my nutrition is still the basis of my nutrition now.
Yes.
And obviously it wasn't with gestational diabetes, it was for a whole other reason. But it really does change the way that you look at nutrition as a whole. It changes your habits around it. It changes how you feel about your food choices. It changes the types of foods that you eat. I can't say enough positive things about my experience working with a dietitian. So I 100% think that any woman that's facing this kind of crash course of gestational diabetes management would be so beneficial to working with someone like yourself. So
That
before we finish off, I have one more thing to ask you, which is something that I ask everyone that comes on the podcast.
yeah,
What's the one thing you wish all women knew
yes.
before they had a baby?
Putting on my dietitian's cap, it would definitely be to be more discerning about where you get your nutrition information, and in fact health information from in pregnancy. So if you're
Mm-hmm.
going to get some nutrition advice, or you're reading nutrition advice, look at the credentials of the person dispensing that advice. Are they an accredited practicing dietitian or an accredited practicing nutritionist? Some countries it's a registered dietitian. That's a postgraduate qualification in nutrition, and you're getting evidence-based information. Be very careful Googling gestational diabetes and diet. All sorts of wacky articles will come up, many of which are not evidence-based. And be a bit discriminatory with social media. If you're following an influencer that's had gestational diabetes, of course their experience might be interesting and entertaining, but it doesn't mean it's professional advice. Or if you're on a Facebook group of mums with gestational diabetes, now that can be emotionally supportive to know that there's others out there like you. But again, the comments on those groups are people's own reflections or own opinions. Is not professional advice, and it may not be relevant or appropriate for you. So I think the main thing to say is there's a lot of noise out there in the nutrition world, and just be discerning as to where you get your information. Make sure it's from a credible source. That would be my message.
I 100% agree with that. I feel like we're very aligned. We work in completely different
Yeah,
areas, but still supporting women through this beautiful
Yes,
stage.
absolutely.
And also the messaging is very aligned. So
Yeah.
I love all of that. So thank you so much. And I thank you so much for all the incredible work that you do for women that have been diagnosed with gestational
Thank you.
diabetes, because I know you put so much content out there that's really helpful. And I know that women do find it helpful. So thank you so much for everything that you do for women in this beautiful stage of their
Well,
life.
thank you, Tammy, and thank you for the opportunity to spread the message and get some more information out there to help women in this situation. I've loved being on your podcast today, and thank you for the great work you do with educating women in this sphere.
And if you're hearing this message, I want to say a huge thank you, because it means that you've listened to this entire episode. Of course, if you have any questions about the things that we covered in this episode, or want to know more about me or my other projects, you can find me on YouTube and Instagram at The Pregnancy Process. For those currently in their conception or pregnancy journey, you can actually apply to join my complimentary but private community, the Preggy Training Crew. And you'll find my community application and social media links in the episode description. And of course, if you enjoyed this episode, I absolutely encourage you to share it with other women just like you. And I look forward to seeing you in the next episode.